Here at 5 o'clock, a patient has filed a lawsuit against the University of Kansas health system, claiming doctors misdiagnosed her and didn't tell her and unnecessarily removed part of an organ.
41 Action News investigator Jessica McMaster read through the complaint and is outside the hospital with the details. Jess.
Here's a copy of the complaint. The patient says she was diagnosed with pancreatic cancer in 2015, that doctors here at the hospital removed a portion of her organ. She thought she was cured, but says she later learned she never had cancer to begin with. Misdiagnosis followed by a cover-up is what patient Wendy Berner claims in her 74-page lawsuit filed against the University of Kansas Hospital, Medical Center, and physicians, and 2 doctors specifically. She's seeking monetary damages. Berner claims after having a portion of her pancreas removed, doctors told her she was cancer-free, but never disclosed that her test results came back negative and that her initial diagnosis of pancreatic cancer was wrong. According to the lawsuit, the chair of the pathology department admitted her mistake in diagnosing Berner to the surgeon, but no one ever told the patient. It wasn't until reading a lawsuit a whistleblower filed against the hospital that Berner learned she never had cancer. In that lawsuit, a doctor claims he knew Berner was misdiagnosed and unnecessarily operated on. He says he brought the information to the attention of hospital administrators, but they wouldn't investigate it. Instead, threatened to have him fired. The hospital didn't return our calls for comment, but issued this statement that reads in part, "We do believe that our physicians and staff acted appropriately and with the best interest of our patient in mind." The patient says she has complications as a result of the surgery and will be on lifelong medication. I'm investigator Jessica McMaster, 41 Action News.